Please come forward. There are too many vacant seats here. पाठीमागची लाईन पुढे या. ह्या साईडला या.
प्रॉब्लेम सर सर होते का आवाज जातो की सर जातो तिला मेन सुरू झाला ना हायटेड माणसाचा प्रॉब्लेम
Good morning all. Very pleasant morning to all to have all of you in this auditorium hall. To be very honest, madam, today we are having two important papers which were postponed, so we couldn't get too much of our research scholars here because we are having 24th and 25th. These are delayed papers we are conducting all over. So the seats are vacant, otherwise it would have been totally full. So no matter, quality is important than quantity. Let's begin. A very pleasant morning to all the present in the conference hall and also the research international scholars from Sri Lanka and Malaysia and all over India in an online as well as offline mode. On behalf of the organizing committee, I, Dr. Atul Tanaji Lakde, welcome you all for this international conference. It's my duty to welcome today's chief guest, Honorable Vice Chancellor, the Registrar, the Director of Examination and Evaluation, Finance and Account Officer, all Punyashlok Ahilyadevi Holkar, Solapur University, Solapur, Maharashtra, and the international speakers from Malaysia and Sri Lanka. The eminent chairpersons for this conference, the director of different schools of Punyashlok Ahilyadevi Holkar, Solapur, University Solapur, principals of different colleges, all our media representatives and participants, welcome you all. Honorable Vilasrao Ghumre sir, Secretary Vidya Vikas Mandal Karmala, is a source of inspiration behind us to take up a step at an international level and organize this 2 days international conference. Thank you, sir, for your motivation and guidance. Yashwantrao Sawan Mahavidyalaya has been preparing from last 2 to 3 months for this international conference, and it's totally the teamwork and hard work of all our colleagues that we all are seeing this today's opening ceremony. I express my sincere thanks to Honorable Vice Chancellor because this is the first time that a college which is not related to the directly to the schools of this university is organizing a conference here, and I really thank on behalf of the organizing committee to Dr. Mrinalini Fadnavis Madam for granting us to conduct this international conference and providing us the infrastructural support that we needed for this conference. So I request all to please Vice Chancellor. Today I am gathered here for the opening ceremony of the 2-day international conference titled Yoga, Nutrition, Scientific Training Methods and Rehabilitations for Avoiding Attraction of Doping in Sports. This international conference is sponsored by Indian Council of Social Science and Research, New Delhi, ICCR. And to promote research in sports and to celebrate 75 years of independence, this conference is sponsored in the scheme of Azadi Ka Amrit Mahotsav. The initiative is taken by our Honorable Prime Minister, Mr. Narendra Modi. India is a rich country with cultural values. So before we start with our to light the lamp and garland the photo of Saraswati. Lighting of lamp is a symbol of luminance and brilliance which helps dispel the darkness and enlighten us. And also, I request the honorables to please garland the photo of goddesses Saraswati, goddesses of knowledge, music, art, speech, wisdom, and learning. Honorable Vice Chancellor, Ms. Mrinalini Fadnavis, Madam.
Clear it.
International Resource Person, Mr. Gary Cohn. Mrs. Anumarathan Aike, the person who coordinated to us in all aspects, Mr. Dr. Rajesh Kumar from Hyderabad. Honorable Secretary Vidya Vikas Mandal, Mr. Vilasrao Ghumre sir, President, Mr. Milind Fund sir, and Principal Honorable Lakshman Patil sir. Thank you everyone. Thank you very much. Goddess Saraswati. Thank you once and all. We are already late, so we'll directly move on to the felicitations ceremony. First, I request our Honorable Vilasrao Ghumre sir, Secretary Vidya Vikas Mandal Karma, to felicitate Honorable Professor Mrs. Mrinalini Fadnavis, Vice Chancellor Punyashlok Ahilyadevi Holkar, Solapur University, Solapur. Most creative and supportive Vice Chancellor. I request you, sir, once again to please. Yogini Madam is not here. International Resource Person, Dr. Gary Cohn, Associate Professor, Exercise and Sports Science Program, School of Health Sciences, University Saint Malaysia, Kubang, Kereng, Malaysia, and he's also a Secretary. I request Principal Honorable Mr. Milind Fund sir to please felicitate International Resource Person Mrs. Anumarathan Aike. She is a Senior Lecturer, Department of Sports Science and Physical Education, Faculty of Sports Science, University of Sri Lanka. President Vidya Vikas Mandal. We have Honorable Registrar, Mrs. Dr. Yogini Ghare, Madam. Please welcome her. I request Vilasrao Ghumre sir to please felicitate Dr. Mrs. Yogini Ghare, Registrar, Punyashlok Ahilyadevi Holkar, Solapur City, Solapur. Ghare Madam. Same color. Same blue color. Blue color. Green color. I request Milind Fund sir to please felicitate Dr. Rajesh Kumar, In charge Director of Sports, Osmania University, Hyderabad, Principal University Education, also President of International Federation of Physical Education, Fitness and Sports Science Association. I request Principal Dr. Lakshman Patil sir, Principal Yashwantrao Chavan Mahavidyalaya Karma to felicitate today's respected and eminent chairperson for this two-day international conference, Dr. Pradeep Deshmukh sir, who will preside as the chairperson for all the paper presentations. He is Director of Physical Education at Srimati Sushila Devi Deshmukh College, Latur. He is the chairperson, Board of Study and Management Council member of Swami Raman Tirth Marathwada University. I request Principal Sir to please felicitate the second eminent chairperson for this international conference, that is Dr. Shatrunjay Kote, Principal, Marathwada Sanskritik Mandals, College of Physical Education, Aurangabad, Maharashtra. Now I call upon our Vice Principal, Dr. Anil Salunke, to please felicitate today's resource person, Dr. Abhijit Jagtap. He is an MBBS or Solapur University, Solapur. Dr. Abhijit Jagtap. I request Soundke sir to please do the felicitation of Dr. Mrs. Manali Kane madam. Always a big fumble while taking her name. Very genuine, gentle person, a resource person for today's international conference. She is MSc PhD in Food and Nutrition and a visiting faculty for School of Allied Sciences, Puneshlok Ahilya Deolkar, Solapur University. Thank you, sir. Now I request Professor Abhimanyu Mane, IQC Coordinator, Yashwantrao Chavan Mahavidyalaya, Karma, to felicitate Mrs. Nehal Pense, Madam, resource person. She is MSc Yoga, member of National Yoga Sports Federation, teaching faculty Allied Health Sciences, Puneshlok Ahilya Deolkar, Solapur University, Solapur. Last but not the least, Dr. Yogesh Sir, resource person. He is an associate professor, Department of Pharmaceutics, DSTL College of Physical of Pharmacy, Solapur, in Maharashtra. Abhimanyu, I request you to please. Once again, a very heartily welcome and thank you to all for this for attending this two-day international conference. Now we have a special book publication by the hands of Honorable Vice Chancellor Mrs. Mronali Fadnavis Madam and Honorable Secretary Vidya Vikas Mandal, Mr. Vilasrao Gumre Sir. This book has been written in Marathi. The name is Purnanna Ek Amrut, published by Puneshlok Ahilya Deolkar, Solapur Vidyapit, Arogya Vibhag Samkul, पोस्ट ग्रॅज्युएट डिप्लोमा इन डायटिक्स अँड न्यूट्रिशन या अभ्यासक्रमाच्या विविध विद्यार्थ्यांनी तयार केलेल्या पोषक व चविष्ट परंतु लो कॅलरी रेसिपी बुक असून सर्व सामान्य लोकांना आवडणाऱ्या आणि गृहिणींना घरच्या घरी तयार करता येतील अशा अनेक रेसिपीज यामध्ये समाविष्ट आहेत. या पुस्तकाचं संपादन संकुलाचे व्हिजिटिंग फेलो डॉक्टर मनाली काने मॅडम यांनी केलं असून संपादक संकुलाचे समन्वय डॉक्टर अभिजित जगताप यांनी केलं आहे. हे पुस्तक तयार करण्यासाठी विद्यापीठाच्या कुलगुरू डॉक्टर मुरारी फडणवीस मॅडम, संकुलाचे प्रभारी संचालक डॉक्टर विकास घोटे सर यांचे मार्गदर्शन लाभले आहे. तर सदर बुक हे विक्रीसाठी सुद्धा उपलब्ध आहे. मी मान्यवरांना विनंती करतो की या पुस्तकाचं प्रकाशन सोहळा पूर्ण करावा. घोटे सरांना विनंती आहे की त्यांनी कृपया स्टेजवरती या. It was the time of COVID when this course was run, and all the enrolled students have contributed to the publication of this book. Thank you. When you are organizing a big event, there is always a person who is not in front but is always behind us, silently without any to felicitate our respected principal Dr. Suresh Pawar sir. A very key role in organizing this international conference. I request Mr. Vilasrao Ghumre sir to please do the felicitation. Mr. Pawar sir is rightly a principal of College of Physical Education Solapur. He is an ex-registrar and proudly to say he is the director of sports of this university. Yes, sir. And the thing which should I specially mention that a person belonging to our faculty is working very hard and being elected in the Senate for twice, and right now he is being elected as the Management Council member. I call upon Professor Sachin Gaikwad sir to please come up. I request our Principal Milind Fund sir to please do the presentation. A big clap for Sachin Gaikwad sir. With the felicitation function, I request Principal Dr. Lakshman Patil sir, conference convener, to please come up and give his introduction speech.
Honorable Vice Chancellor of the University, Professor Dr. Manalu Fadnavis Madam, Registrar of the University, Ghare Madam. I had been with her in Mumbai University many times. The Secretary of our institution, Honorable Vilasrao Ghumre, our researcher, Garib Kaun sir, Anuma Ratnamaki Madam, Rajesh Kumar sir, instrumental person in this conference, the President of our society, Principal Milind Fund sir, Pawar sir, Deshmukh sir, Kote sir, Dr. Abhijit, and other dignitaries and dear participants. This venue, our college is at the apex of Solapur Pune, Ahmednagar, and Osmanabad district. 4 districts are together. Still, we felt that it is not convenient for the participants to come there and to have a convenience of all these things. Rather, we selected the apex of not district, but the apex of the states. So Solapur is at the apex of Maharashtra, Karnataka, and Telangana. So that's why it is more convenient. For that, I came to Vanchesman Madam for requesting to give us hall. Immediately, without a fraction of second, she saw the calendar. Okay, it's done. Madam, I am indebted for you. So our college is always vibrant in conducting every day or day 1 or 2 activities bound to be there in the college. So many activities. Small, I will say history that then MLA Namdevrao Jagtap went to Karzat, where Yeshwantrauji Chavan came there for the opening of the college. At that time, Namdevrao requested Yeshwantrao Chavan, we also want a college. And Yeshwantrao immediately, that Karzat college was the college of Rayat Education Society. So Yeshwantrao Chavan said, why you are affiliating or connecting your college to Rayat? You can establish your own society and run the college. Accordingly, the college was established in 1966. Now, the college is established, but problem of giving the title to the college, and the title was given Yeshwantrao Chavan because we know Yeshwantrao Chavan was expert in all work type, all fields. Especially, he was interested in education, paying the fees. And he gave the relaxation, those who are poor, for these students, he gave the relaxation in the tuition fee. So that is why post-independent students, we see generation is shaped, the generation shaped their lives and developed or shaped a career. And so that's why the title for our college, Yeshwantrao Chavan Mahavidyalaya Karmala, is very apt one. And we feel very proud for that. Now our management, after many years, now Vilasrauji Gumre sir is the secretary of our college. So he is always having, that is a fine tuning towards the education. Our only requirement is, or our only motto is, to give the education to the Mofussil students. And that we have been doing that under the able guidance of Honorable Vilasrauji Gumre sir. Milind Fund sir is there. Always they have the eagle eye on our college activities and the support, and they guide us. So this seminar is possible because of the fund or grant issued by the ICSSR. ICSSR, that is Indian Council of Social Science Research. So it was also established in 1969. And it is prime function is to provide the grants for the social sciences research and help to organize conferences, seminars, and the aim is that intellectuals should come together, they share their knowledge, and we should have some good things in that. So keeping in this mind, I am also thankful to ICSSR for supporting us for giving this seminar here. Now the seminar, the title of the seminar, when at first you see, it is like that yoga, nutrition, scientific training methods, and rehabilitation for avoiding the doping in sports. So when Dr. Atul came to me having this title, I told him this is rather a strange one. Title is very long one, but then I thought over that. And so I connected the beginning and the end of the title. So that yoga and doping in sports. So yoga is, madam is there, the yoga is playing very important role in controlling the mind as well as body. That's very important. So many know that yam, niyam, asan, pranayam, dhyan, dharana, and so in this way, these are some of the aspects that yoga give us. So I think that yoga can control such a type of attraction in the doping. So what is the purpose of games? What is the purpose of sports? So the purpose of very sports is to cultivate human beings. This is the one. And another is through the sports and games to contribute to the world peace. Is the sports now cultivating the human beings? Are the games contributing to the world peace? This is the problem. Certainly not. Now, what matters? It matters winning and losing. Rather, winning is important. So, winning is important, and when winning is important, at that time, doping is necessary. So, we lost all ethics. And when somebody lose the ethics, then we don't have any right toward the mental peace also. But yoga can contribute in that. And so I request all the delegates, intellectuals here, how effectively yoga can contribute for avoiding the attraction of doping in the sports. That can be checked. Doping is checked or tested. It is not tested in state level many times. In state level sports, it is not tested. Still, we give awards to the winner. Doping is one person, and the player is one person. Both persons are fighting another person, one who is not having practices these things. So I request all the delegates and intellectuals to discuss over the issues and to find out certain solutions how we can overcome these problems of doping. So nutrition is another thing. What we eat today, everywhere we see Chinese centers, stalls, Chinese. It is very tragic one. In my college also, girl students are always having 5 rupees or 10 rupees kurkure packet. So I many times advise them, don't use that. There are many reasons. Unnecessarily you are polluting the environment having these wrappers. In 5 rupees, if you are getting this one, nutrition, I suggest you can have groundnuts, you can have many types of other seeds in our home. You can put in the water. Next day you bring with them, eat it. It will be healthy one. When they go past from the course, know that lakhs of rupees are going to be wasted. Still, mental satisfaction is not there. So, if nutrition is proper, athletes or sportsmen always having a kind of chart with them. On Monday, Tuesday, Wednesday, Thursday, Friday is required, necessary, I think, one which is the healthy one. The scientific training for the people, all of us, is must. And say, sound body, sound health, sound soul is there. So why we should not have a sound mind and sound body with the help of yoga and nutrition? We should have, because when we see this earth, the world with our physical eyes, the eyes should be there. Proper eyes, the proper health can be. So this is a very difficult task. It is, I don't claim immediately it will be after having this conference, everywhere the doping will not be there. It is not that. So we all together should have our efforts, and for that ICSSR gave us financial assistance. I know this difficult task, that's why I quote some 3-4 lines of Robert Frost, the American poet. Metaphorically he wrote some lines, and the lines were on the table of Pandit Jawaharlal Nehru when he was passed away. The lines are to be considered by metaphorical meaning. So woods are lovely, dark and deep. The woods are lovely, dark and deep, but here I is written. But I have promises to keep. Instead, I say, we have promises to keep. And miles to go before I sleep. And miles to go before I sleep. So this is our endeavor. With these words, I end. Thank you.
I request Honorable Vice Chancellor Mrs. Mrunali Fadnis Madam to declare this international conference open and give her introduction.
Good morning, namaskar to everyone. On behalf of Yashwantrao Chauhan Mahavidyalaya Karmala, District Solapur, and all other resource persons from the sports and physical sciences at the premises of Punyashloka Ahilya Devi Holkar Solapur University, Solapur, you all. And really, it's a pleasure that we are having 2 days international conference on a very different topic, which is related to doping. I declare this particular international conference open. Various people from different walk of life, the topic as well as very important culture which is being developed at the international level, which is related to sports, physical education, and the science behind it. So I'm again welcoming you all. All the dignitaries talked to me a year back that we want to organize this program. Then all the people from this society, the principal sir, the secretary, they have really made an effort that this should come on the platform of at the international level. And definitely this will become a landmark in the sports, in the history of the sports and physical sciences. Then we have international speakers, Dr. Gary Horn, then Mrs. Anoma Ratnanaika, and from Hyderabad, from our own place, Dr. Rajesh Kumar. And I am really happy that other chairpersons as well as the resource persons are with us for a day long, or rather the 2 days discussion on this particular topic. Now, considering the issues which has been supposed to be discussed or raised for development of our youth, as well as the people behind this particular for understanding what is sports and physical education and all these issues which is related to the science, even I will say it's also the art, because where you can put your art for best effort as a sports person. I think this is very important to understand that how internationally this particular section is getting enriched by different type of societies. Even in our recent past, we should say that our Honorable Prime Minister has given special focus to the sports persons. Our sports persons are really shining at different levels, at international levels, due to various programs like Khelo India. So this is one of the thing which we are really developing. But I know the other developed countries, they have done a lot in this areas, and from very beginning, like the child is 4 years or 5 years of old, then only they start training if the inclination of that particular child is towards that area. So I think that type of framework, that type of, you can say, the working is necessary if you really want to reach to the greater heights in not only in your country but at the international level. And considering the other facts which is now very much important for overall development of the personalities, this is one of the various important sector which is known as health sciences. I think it has been very well taken care in the SDGs, that is, you can say the development goals which has been, or the sustainable development goals which has been taken care by UN. But let me tell you that India is already enriched by such type of activities from, say, the period of Ayurveda or the yoga culture, where we are developing our people in these. Unfortunately, some time has passed in such a way that we have literally not implemented all these things or forgotten to take care of this yoga, Ayurveda, and other naturopathy sort of things, which is very important or very, you can say, the robust way to develop the human development or the human capital. So, along with this sustainable development goals, we have our own national sustainable development goals. And in that, we are trying to focus on the issues of sports, culture, arts, various things. And the new thing which has come up, considering the yoga and meditation, is really not only the part of the education system, but it has become a part of the day-to-day system of your health as well as physical and mental health both. With the help of different faculties, those who are present over here, we have started different courses in the universities. We have started from like courses which are of 3 months, then we have started with the 6 months, and I'm very happy to share that we have reached 1 year nutrition diploma course as well as now 2 years yoga course in a degree form we are giving to the students. So this has become the need of the hour, when students are saying that because of this, we are not only get the jobs, we are not even the employable, but we are also giving message to the society that how you can develop yourself through such type of education, knowledge, and of course the transformation of the knowledge. So this is the part we have taken care with the help of our Allied Health Science Department. Then I was again talk about the Sustainable Development Goal, where the fourth goal of the Sustainable Development SDGs is a human capital development. And in that human capital development, we are focusing upon the various areas which is very much taken care by our own history, that is our ancient Indian history. We were thinking about the 64 type of you can say, we in our language we used to say kala means art, and 64 types of art a student is supposed to gain in the student life. But when we now see, we can hardly reach to 1 or 2 class or do arts to gain all these things. So how our people were empowered or enriched that time, those who are having 64 kalas or the art, whatever those, they were all, which is like related to performing art, which is related to different type of skills, different type of culture we were having at the time of the universities which were having the global ranking that time, Mohenjo-daro, Hadappa, Sanskriti, as well as the Nalanda University, which has been of course newly established, but earlier university was very much different. And those type of having different names, even the Vikramshila, Takshashila universities are having all these type of enrichment with the students. They were used to do right from the morning, the student used to be busy, and till night they can have this type of courses or this type of system, not only for her or him, but for entire society, how they can contribute. This was the concept given in the earlier times. And I'm really happy that with such type of organizations or such type of conferences, we can definitely regenerate, we can definitely reform. All these type of things may not be in a very larger form, but this beginning can definitely give a boost to develop such type of issues which is very close to the human capital and human development system. In sustainable development issues, we have also now introduced a lot of things which is important, but some of those who are really very strong, they should have, and if they are somewhere wrong somewhere, how they can be again settled in their system, so that whatever the possibilities for getting better human or the better human development of that person should again be thought about it. So these are the things which we are again pondering, again try to put in the system. That is the important part which is happening in India. And it is very rightly said about the ethics. When you have taken the topic of this doping in sports, the ethics come first. And when if you are not following that, then definitely there is always a question that why is this happening? You want a very fast result, or you want a result maybe in a wrong way, but by hook or crook you want to get some medal or some but that will be again a temporary thing that cannot give you the permanent satisfaction in your life. So better to empower yourself with the help of, like the topics has been taken, yoga, nutrition and scientific training. I really congratulate you, sir, and your team, Gumre sir and your team, that you have thought of such topic, that these are the important ways to understand how to go in a correct way. Maybe we are talking for the sports today, the other areas like those who are going for the research, scientists, maybe from the chemical science, you take anything. It is all, of course, important for them also. The values and ethics will definitely make you much greater, much powerful, empower yourself in these areas, and in that way we can definitely say that such type of deliberation, whatever we're going to gain out of this, we can definitely give all this knowledge to the students, those who will be continuously with us in the tenure of our own working in the universities or in the colleges. So this is very important that such topic has been taken up, and this will gain attention not only at the local level but at the global level as well. The resource persons and all the important persons, those who are experts in this, they will definitely talk on such issues, and you can have a lot of discussions on such areas if it is happening, how to correct it. And there are definitely ways with us which can give the solution for the students to understand the area of this particular issue. So I again welcome you all at the university. Our university is young, 18 years old university, but still we are trying to make many things which is of international level. And I'm very happy the college like Yashwantrao Chauhan Mahavidyalaya has been associated with us, like other colleges has also been associated, and with the help of such type of institution, we are definitely growing at the global level. Just 2 days back, we have a MOU with US consulate for regarding different type of activities. Prior to that, like with the Malta University or the Finland University. So this way we are trying to get university to reach to the global heights, and I hope you will enjoy in the university. Please feel free in the campus. Our staff and all the college staff, they are also there to take care of all these things. I'm really happy that Dr. Gary Han is there. We were just talking to him, and I'm really happy to tell you that the way they are thinking about the sports and physical education in the science term, I think your inputs will be very useful for the development of the sports over here in this campus. Equally, I'm happy to have Miss Anoma here, and we met in Sri Lanka a few days back, and we were that time thinking that yes, what is the contribution of the neighboring countries is equally important. She is also having a rich experience, you can be benefited through it. And our national speaker Rajesh Kumar, he is also having lot of experience. He was telling that organizing such things is my passion. So I hope this type of workshop will be very important for all of us, and including all chairpersons and resource persons. I welcome you all again here. Thank you very much, and have a good day ahead.
Thank you, madam, for your expert guidance and sharing all your knowledge to us and promoting us to take more step forwards in this department as well as at international level. Now, I request Honorable Vilasrao Ghumre sir, Secretary, conclude. त्याच्यानंतर presentation तुमचं झालं. I request Honorable Vilasrao Ghumre sir, Secretary Vidya Vikas Mandal, to please come up and express his views.
नवीन हॉलमध्ये मॅडम ते ट्रान्सलेशन काय असतं ना, सगळ्या भाषेत बोललं सगळ्या कळालं, तेवढी एक सुविधा करा म्हणजे आमची सुविधा होईल सगळी. मी मराठीत बोलतो, ह्या दोघाला सोडून बाकी नंतर ट्रान्सलेशन राजेश कुमार करतील. ते आंतरराष्ट्रीय क्रीडा परिषदच्या निमित्ताने आज आयोजित केलेल्या या सेमिनारला आमच्या यशवंतराव चव्हाण महाविद्यालय आणि आपल्या पुण्यश्लोक अहिल्यादेवी विद्यापीठाच्या संयुक्त विद्यमाने आयोजित केलेल्या समारंभासाठी उपस्थित असलेले आपल्या विद्यापीठाच्या कुलगुरू माननीय फडणीस मॅडम, त्याचप्रमाणे उपस्थित असलेले रजिस्ट्रार घारे मॅडम, त्यानंतर मलेशियाहून आलेले गॅरी कौन बा, इंटरनॅशनल दुसरे श्रीलंकेहून आलेले MKL अनोमा मॅडम, त्याचबरोबर उपस्थित असलेले हैदराबादून आलेले राजेश कुमार, ते चांगले कोऑर्डिनेटर, सगळं अष्टपैलू व्यक्ती होते, मी आपल्याला लक्ष दिले. त्याचप्रमाणे उपस्थित असलेले आमचे जवळचे आपलं देशमुख, प्रदीप देशमुख साहेब, पवार सर, आमचे ते जवळचे मेवणे लागतात दोघं पण. त्याचबरोबर आमचे मित्र गायकवाड साहेब, कोटे सर दुसरी वेळ आपल्या संभाजीनगरचे, आणि उपस्थितामध्ये सर्व वेगवेगळ्या ह्या भागामध्ये सेमिनारमध्ये भाग घेणारे, तसेच आमच्या यशवंत ग्रुप. वास्तविक पाहता आमच्या महाविद्यालयाचं स्थापना वगैरे आमच्या प्राचार्यांनी तुम्हाला थोडक्यात सांगितलं आहे. या महाविद्यालयामध्ये मी 1972 सालापासून एज्युकेशन, सर्व्हिस, मॅनेजमेंट सगळ्या थरावर जवळजवळ मी गेले 35 ते 40 वर्ष या महाविद्यालयाचा सचिव म्हणून काम पाहतो. वास्तविक पाहता ज्यावेळेला आमच्या लकडे सरांनी संकल्पना मांडली की आपल्याला आंतरराष्ट्रीय परिषद क्रीडाच्या संदर्भातले घ्यायचे आहे, माझा आमच्या कॉलेजमध्ये प्राचार्य असू द्या, खास करून लकडे सरांना वगैरे फुल स्कोप असतो. जे जे आपल्याला महाविद्यालयाच्या दृष्टीने काय ग्रँट असू नसू, काही वेळेला आपण संस्थेच्या वतीने तुम्हाला संपूर्ण सहकार्य असेल, त्या पद्धतीने सगळं आमचं महाविद्यालयाचं कामकाज चालतंय. महाविद्यालयामध्ये आज 3,500 विद्यार्थी बसण्यासाठी आमच्या बिल्डिंगची 3 मजलीची व्यवस्था आहे. 100 मुलींचं हॉस्टेल आहे. 3,000 मुलं बसतील एवढं आमचं ऑडिटोरियम हॉल आहे. जसं अभ्यासामध्ये हुशार विद्यार्थ्यांना प्राधान्य दिलं जातं, तसंच खेळामध्ये मुलांना तेवढंच प्राधान्य दिलं जाते. त्यासाठी मॅडम परवा आम्ही 15 एकराचं आमचं ग्राउंड आहे, त्या ठिकाणी आपण विद्यापीठामध्ये तालुका लेवलला प्रथमतःच तुम्ही आम्हाला परमिशन दिल्यामुळे क्रिकेटच्या स्पर्धा घेतल्या होत्या. आणि अशा पद्धतीने आमचं जवळजवळ 29 एकराचं परिसर आहे. वास्तविक पाहता मी एक कल्पना केली होती की जर हे आमच्याकडे परिस्थिती होती, परंतु काही गेस्ट आपल्या कुठल्या गोष्टीसाठी नाराज होऊ नये, सरांनी आदरणीय मॅडमला रिक्वेस्ट केली आणि मॅडमने आपल्याला या सगळ्या सुविधा उपलब्ध करून दिल्या. त्याबद्दल मी संस्थेच्या वतीने मॅडमचं आभार मानतो. वास्तविक पाहता आज ह्या संदर्भामध्ये वेगवेगळ्या पद्धतीचे निबंध वाचण्यासाठी वेगवेगळे सर्व ह्या या क्षेत्रातील मंडळी आलेली आहेत. आपला विषय आंतरराष्ट्रीय क्रीडा स्पर्धेमध्ये अंमली पदार्थाच्या सेवनापासून तो खेळाडू आपल्याकडं दूर कसा राहील, त्यासाठी तुम्ही त्यांचा आहार कसा असावा, व्यायाम कसा असावा, ते तुम्ही अजून काय काय सगळ्या गोष्टी सांगितल्या. परंतु आपण कुठलीही गोष्ट विद्यार्थी घडवताना जसं प्राध्यापकाला प्रत्येक विद्यार्थ्याचं नेचर माहीत असतं, त्याचे गुण आणि दोषही माहीत असतं, त्याच पद्धतीने मला वाटतं ही सगळ्या सूचना ह्या आपल्या एकमेकाला होतील, पण ह्या सूचना विद्यार्थ्याकडे जर पोहोचायच्या असतील तर क्रीडा क्षेत्रामध्ये जे आपलं तुम्ही काम करताय त्या लोकांना, त्या प्राध्यापकांनी आपल्या महाविद्यालयामध्ये ज्या वेळेला कुठल्या खेळामध्ये विद्यार्थी येतो त्या विद्यार्थी देखील त्याचा स्वभाव, ते सायकोलॉजिकल सगळ्या गोष्टी आपल्याला माहीत पाहिजे. जर महाविद्यालयामधनंच तो क्रीडा क्षेत्रामध्ये चमकत असताना तुला पुढच्या वेळेला आपल्याला कुठल्या कंपनीत जॉब मिळाला तुला याचं मदत होईल, त्याच वेळेला तो मुलगा आपल्याकडं आपल्याकडं तो विद्यार्थी दशेत असताना, खेळाडू असताना कुठल्याही अंमली पदार्थाकडे जाणार नाही, हे जे आपण आपल्या पहिल्या स्टेपला काळजी घेतली पाहिजे. त्याला जर एकदा त्याला कळलं की अंमली पदार्थाच्या सेवनाच्या फोर्समुळे आपला नंबर येतोय तर हे असंच पार्सल पुढे जात राहते. त्यामुळे हे बेसिकली काही दुरुस्ती सगळं जरी आपला आहार बिर असला तर हे करणं गरजेचं आहे. त्यामुळे मी सगळ्यांना प्राध्यापकांना विनंती करतो की आपण जसं उपायाची काळजी करतो तसंच या खेळामध्ये नैपुण्य घेणाऱ्या विद्यार्थ्यांची तुम्ही कृपया काळजी घ्या. कारण मी देखील पूर्वीपासून इंटरनॅशनल झोन बिन खेळायला विद्यार्थी आहे. त्यामुळे मला त्याचं महत्त्व वाटतं. आणि जसं खेळामुळे मला आपण प्रत्येकाला आपापली प्रकृती व्यवस्थित ठेवा वाटतं. माझं आता 69 वय आहे आणि ह्या फक्त खेळाच्या लोकांच्या सानिध्यात तर एक मन प्रफुल्लित होतं. माझ्या बंगल्यापुढंच सगळा ट्रॅक क्रीडांगण असल्यामुळं रोजचं माझं नीतिनियमाने व्यायाम आणि असतं. असंच आम्ही आमच्या प्राध्यापकांना आम्ही यशवंत ग्रुप म्हणतो मॅडम. आमच्याकडे शिपाई ते प्राचार्य सर्व आम्ही एक आहोत. ओनली फॉर यशवंत ग्रुप. अशा पद्धतीने आम्ही स्टाफ विद्यार्थी यांच्या संदर्भामध्ये थोडं बारकाईने लक्ष घेतोय. कारण तुमच्या नजरेच्या टापूतलं शेवटचं कॉलेज आमचं आहे. परंतु तुम्ही ज्यावेळेला इथं चार्ज घेतला की म्हणलं पहिली आपली ओळख व्हावी त्या दृष्टीने त्यावेळेचं संकल्पना अशी होती की आपलं पंढरपूरची वारी स्वच्छतेचं अभियान केलं होतं. त्यावेळेला मी आमच्या संस्थेच्या वतीने 1 लाख रुपयाच्या त्या मुलांना टोप्या वगैरे आपण काही दिल्या होत्या. मला त्या निमित्ताने मॅडमची आपली ओळख राहील. आणि अक्षरशः मॅडमच्या आमच्या कॉलेजमध्ये 2 व्हिजिट झाल्या. अत्यंत आमच्या कॉलेजकडे बघण्याचा पॉझिटिव्ह दृष्टिकोन आहे. कुठलंही आमचं शैक्षणिकदृष्ट्या कुठलंही काम नडत नाही. अशाच पद्धतीने आम्हाला मॅडमने जे सहकार्य केले ते देखील धन्यवाद मानतो. आणि आपण सर्व अशा ह्या आंतरराष्ट्रीय परिषदेला उपस्थित राहिल्याबद्दल संस्थेच्या वतीने सगळ्यांचं स्वागत करतो, आभार मानतो. इथं थांबतो. जय हिंद, जय महाराष्ट्र.
Thank you, Honorable Vilasraoji Ghumre sir. Two sides of development of human are very necessary. One is academic and other is physical. Physical, we are trying a lot of hard work, putting our efforts, but education also support is very important. So that is the reason we have dared to organize this 2 days international conference. Definitely, we have strong support from the allied health sciences. Gute sir is there and Jagtap sir is there, with whose guidance we are successfully organizing this international conference. To conclude the opening ceremony, I call upon the IQC coordinator of Yeshwantrao Chavan Mahavidyalaya Karmala, Professor Abhimanyu Mane, to express his vote of thanks.
Very good morning, honorable dignitaries and participants. It has been such an honor to be the part of this wonderful opening ceremony. On behalf of our institution and Yeshwantrao Chavan Mahavidyalaya Karmala, I would like to extend my heartfelt gratitude to our esteemed chief guest, Honorable Mrs. Mrunalini Fadnavis, Vice Chancellor, Punyashlok Ahilyadevi Holkar, Solapur University, Solapur. I must express thanks from bottom of my heart to our secretary, Mr. Vilasraoji Ghumre sir, president of our institution, Milinji Fund sir, who are the inspiration of this program. I express very sincere thanks to special guest Dr. Yogini Gare, the registrar of this university, eminent international scholars and our resource persons, Dr. Gary Kaun, Malaysia, Mrs. Anoma Ratnaike from Sri Lanka, and Dr. Rajesh Kumar from Hyderabad. Sirs and ma'am, you people are the shining stars of this international conference. Hence, it's my humble duty to express gratitude for being part of this program. For this international conference, we got chairpersons, Dr. Pradeep Deshmukh from Latur and Dr. Shatrunjay Kote from Chhatrapati Sambhaji Nagar. Sirs, you being the chairpersons of this event, you have honored the chairs of our international conference. Hence, I express my heartily thanks. Within these 2 days of international conference, we participants are going to get very scholarly intellectual feasts from the great speakers, Dr. Abhijit Jagtap from Solapur, Dr. Malini Kane from Nagpur, Mrs. Snehal Fendse from Solapur, and Dr. Yogesh Thorat from Solapur. It's my moral compulsion to express sincere thanks for you people for being the speaker of this conference. Last but not least, two leading persons of the international conference who are the brain behind the program are Dr. L.B. Patil, our principal, Vice Principal Dr. A.M. Salunke, and most important person, Dr. Atulji Lakde, Director of Physical Education and Sports, Yashwantrao Chauhan Mahavidyalaya, Karmala. I thank both all of these three people. At the end of vote of thanks, I must salute and say very honest thanks to all the faculty members from my college, that is Yashwant Parivar, and the participants who are the part of this international conference. I express very sincere thanks from my side and my institution. Once again, I congratulate for being here. Thank you very much.
We concluded the opening ceremony, but we express sorry that we couldn't, we have missed out one felicitation. So if you grant permission, should we? I call upon Mr. Sangve sir, Senate member, and he's the sports journalist also. Always he's the key person to flash all the sports news in Divya Marathi. I request Honorable Vilaswa Gumre sir and Fadnavis madam to please do the felicitation. He's a Senate member of Pune Shlok Ahilyadevi Holkar Solapur University. After this felicitation, we are going to have a presentation of Dr. Gary Kahn, followed by Dr. Abhijit Jagtap sir, and ending the first session with Dr. Rajesh Kumar. Thank you. I request everyone to please come forward. The operators, light band kar.
Thank you, madam.
Anyone introducing or you want to introduce karage introduce yeah, no problem. पुण्य घ्या ना पुण्य हा तिथं गुतव हा राहू दे राहू दे तिथे टाचणी आहे मारली राव सुरू झालं आत्ता अंधारात पुढे
Now we'll start with our presentation. I call upon Dr. Gary Kahn to please come up and start his presentation on the topic doping, a criminal approach for sports performance. And I request Dr. Chaturanga Kote to please chair the session.
लॅपटॉप कनेक्ट आहे का नाही तुम्ही स्लाइड चेंज करणार
कीबोर्ड
Okay, a very good afternoon to everyone. University Science Malaysia, whereby I would like to bring greetings to you first. Thank you for the invitations and able to speak to you all on a very simple topic known as doping, a criminal approach for sports performance. Okay, so first of all, allow me to quickly introduce myself. Okay, so my name is Gary, so you can call me Gary, and my website is www.garyquan.com. Okay, so I'm a sports psychologist whereby I work with athletes together, and I follow the teams, athletes, and also bring teams for competitions. And that's why doping is a very important. Badminton is a very huge sport in Malaysia, right? Everyone play badminton in Malaysia. However, we got a case whereby our icon, Dr. Lee Chong Wei, is actually been sentenced for a ban, 8 months ban due to the doping cases. Okay, so some of my awards here, for example, the highest one will be the developing young scholars by the international
a Society of Sports Psychology. That's the worldwide sports psychology. Okay, so you can also find me in here. My research. So I'm an applied practitioner, whereby I work with athletes, I follow with athletes, and I also teach in my university in USM. Okay, so my universities, we are a research-based universities, whereby we do a lot of research. Okay. Publish 30 to 40 research manuals to contribute to the academic enhancement. So for me, I'm now currently one of the top leading research scientists in Asia. Okay, so quickly, I also just want to bring you greetings from our Asian South Pacific Association of Sports Psychology, whereby I'm the Secretary General. Our representative from India is Professor Jolly Roy in Chennai. Okay. Okay. So before I start my talk, I just wanted to show you later, if you have the best question, I will give one of my books. Okay. This book is known as the Psychology Resources for Training the Athletes, and this is one of the books whereby we use with all the athletes in the states of Johor. Okay, so if you see anyone, Ng Ziyong, badminton player who last Monday actually Victor Excelsen in badminton #1. Okay, so that's he also used the books as well, which helped him to win the Sukma National Games gold medalist as well. Okay, a quick overview of my presentations here. So today I will just be going through a simple introductions about doping, and then I will give you some understanding on what are the permitted or prohibited drugs used in sports, because we want to know what is the permitted, so that we know that we can help our athletes which things is prohibited in sports. Okay, then I will follow with some roles and responsibilities, especially as coaches, as practitioners. What are our roles to educate our athletes? Okay, maybe from our teams of a conference is very soothing, whereby you can see that yoga, nutritions, the proper nutritions, the right nutritions, and even then going for the fastest way, which is doping. Okay, so by proper training, proper nutrition, proper psychological training methods, you were able to enhance performance. But what we said is as the ergogenic performance. Okay, so you do not need doping, but you still able to get approach in doping. And then finally, I will make a short conclusion. Okay, so anytime if you want to stop me and to ask any question, it is fine as well. Okay, first of all, people will ask you, why are all these banned substance? We know that all these banned substance is not just bad for you. It also have a very negative effects, a long-term effects for their health, career. Okay, but why people are still motivated to use all this banned substance. So you might ask also, what are our roles as a sport practitioners, as a sport trainers, responsible if we are aware of our athletes taking any banned substance? Okay, if you see that current trends, even in basic supplements, you will find some banned substance inside as well. However, not all athletes will know it. Okay, so what are your roles to educate, to help your athletes to know that this is the banned substance, and even it is just a supplement for recovery, it is just a supplement for muscle enhancements, but it is a banned substance. So athletes should run away. So what are your roles to educate them? Okay. So it is more than the use of performance enhancement drugs. Well, sometimes we use drugs just of medicines to treat illness and injuries. Okay, people take that. Okay, it is prescribed even by the sports practitioners, sports medicine doctors, to use drugs in order to treat illness and injuries. Sometimes even athletes do not know, not intentionally. It can be just a social drugs. Okay, it might be just drinking too much alcohol. Okay, but they were caught as doping. What about illicit drugs like marijuana? Okay, some athletes purposely take it in order to calm themselves, in order to able to enhance, especially for example, shootings and their relaxations and their focus, and to able to lower down their anxieties. Okay, let me say to you that even though it is a performance enhancing, and sometimes even though athletes do not know it, okay, it is still a banned substance. Okay, it is still a banned substance. You should go out of it. It is still illegal. Okay, so let's quickly go through the definitions of doping. Okay, so when we talk about doping, doping is the use of substances and methods prohibited under a sports anti-doping rules. Okay, so it is the substance, anything you take in, or maybe anything you change. Okay, methods prohibited, gene therapy. Okay, that actually changes your body. Okay, to enhance performance. Okay, so it is considered as a doping. Okay, so doping practices are prohibited in sports because first, they endanger the health of the athletes. Okay, want it or not, it endangers the health of the athletes. It actually detrimental effects in the future. Okay, it can be enhancing at the first, but it causes a lot of damage to them. Okay, second, it can be artificially enhanced sports performance. It can be a placebo effects or a real effects, but it still causes a harm to your athletes. Okay, and the most important one is it violates the spirits of sportsmanships. Okay, so imagine people who train so hard, train in and out every day at 5 a.m. training, but a person do not train at all, came in and win a medal. Okay. It is a sad thing, right? Okay, it violates the spirit of sportsmanship, and that's why that's not good, right? So why athletes take drugs? Well, there's many motivations, there's many examples that they want to take drugs, but the reasons for drugs takings among athletes may be varies, but a combination of factors that presence in the most athletes takes. It can be because of their frame. They want to win the medals. Okay. It can be sometimes because as practitioners, sometimes you will see that your athletes are too pressured. Okay. They are too stressed because of their family, coaches, sponsors, in order for them to perform at the peak level. Is one competition they could not perform, their whole entire career, their sponsorship might be gone. Okay. It can be because they want to get an extra edge over their opponents as well. Okay. Or maybe because they want to believe they can be a winner at their mind. So thinking that by taking that drugs, by doing doping, they will able to enhance their performance further. Sufficient. Okay. So a quick one: who can be drug tested? Every athletes, any persons who represent their sports in national, international levels are eligible to be tested. Okay, so some sports organizations even may have anti-doping policy in there. Okay, so for example, when I work with the Australian Institute of Sports, we do have the National Sports Anti-Doping Authorities coming in to check every single week. Okay, so you can see that they are coming here to check athletes A, next week athletes B randomly. Okay, so everyone are eligible to be tested. Okay, so as a practitioners, so we need to always about the in advance of doping. Okay, most sports adopts the WADA codes, which is the World Anti-Doping codes, to determine what are the prohibited or maybe methods that help them to dope. Okay, so it is important that as a sport trainer, as a sports practitioners, we regularly able to check. Stated over 40% of positive tested athletes are actually due to just their use of supplements. Okay, over 40%. So many times athletes do not even know that they are taking some drugs that is prohibited. Okay, so not check every single ingredient. Go to the WADA website that you just type in the name, you will able to find it. Okay, so is your supplement is anytime is in there, okay, or maybe the name is slightly different, don't risk it. Okay, never risk it. So here are the prohibited lists. At all time, of course, there are substances, for example, anabolic agents, and then you have the peptides, hormones, the growth factors, related substances, or even the beta antagonists, the hormones antagonists and metabolic modulators, and the diuretics and masking agents. So if you are working with athletes which are weight category, so for example, you have the karate, the taekwondo, the weightlifters, the wrestlers, okay, which have weight categories, they often go into that categories whereby they are using diuretics to reduce their weights. So we have to be careful. Okay, when they're caught, they will be straight away be banned for their competitions. Okay, other methods in here, it can be manipulations of bloods and blood components. So nowadays people like to use blood doping as well, taking out your bloods and store it. Okay, so 1 week, 3-4 days before competitions, inject back the bloods to the body. And sometimes you will find that athletes could not able to accept it. Okay, and sometimes it even have adverse effects or even if the procedure is not right and not do it correctly, athletes might also have sepsis. So chemicals and physical manipulations, putting different chemicals involving inserting different DNAs. For example, you're doping more on the DNAs to back to a persons which do not have the DNAs. For example, enhancing athlete's performance. So injecting others' DNAs into the person. Okay. So again, the person might also get adverse effects, or even sometimes could not tolerate that as well. Okay. So of course, prohibited in competitions here. It can be stimulants, what that stimulates, cannabinoids and narcotics and glucocorticoid steroids. This used a lot, and also water as well. Okay, so especially in some sports, people use it to regulate their anxiety. Okay, so and finally, I just wanted to quickly talks about the 10 anti-doping rules of violations here. So if an athlete's presence of any prohibited substance or method listed, they will be in the anti-doping rules violations. It can be the use or attempted use of doping, okay? Even just attempted to use the doping, okay? Hey, I'm not too well. I haven't trained for a long time, and then the authorities come to test. You do not want to provide samples. You will also straight away be violated and also be caught as doping, okay, without testing. The whereabouts, you do not want to tell the person where you are in, so you run away from the testing, okay. It can be temporary, of tampering the samples, so you are changing or even tampering the samples. It can be straight away a violations. It can be just processing but not using, meaning you are just taking that substance with you, okay. And it can be also be violations, and it can be trafficking as well, whereby you are trafficking the substance or even administrating or attempted to take the administrating of the doping, or complicity, whereby it means conspiring and asserting some meet an anti-doping rules violations. So you are helping others, or maybe prohibited association by he or she has been found disciplinary on the doping. So you are also one of the violations. So better try to avoid it straight away. Okay. Quickly, what people will take like alcohol and sports. So alcohol may reduce the strength, power, speeds, and cardiovascular endurance, and even healings of injuries. Okay, it been used to help. For example, it may impair athletes' reaction time slower. Alcohol in your coordinations were disrupted, and it also regulations of the body temperatures. So you will see that athletes who drink a lot or maybe have high alcohol level, they will tends to have all these slower reactions. Okay. What are the medications from the side effects? Okay. So the side effects of medications may become evident when used being physically active. Okay, so don't play or train while sick or even injured. So don't take medicine and then go for training. You never know what other side effects will happen. Okay, And always medications only as directed and checked with medical doctors. Okay. So always consult an accredited sport dietitians, nutritionists, and sports medicines doctors before taking any stimulants. You can see that even just energy drinks with simple vitamin addition, it can also found some steroid compound inside as well. So never just take it without knowing the ingredients. Okay. So you can see that there's a case study in 2017 whereby a boy large amount of Mountain Dews and then a McDonald's lattes and just with energy drinks. Okay, within 2 hours consume everything together. Arrhythmia, fast heartbeat, irregular heartbeats, and then he passed away. So it's quite scary, right? So likewise, as a sports practitioners, our responsible trying to educate our athletes, and we do not actually ask them to take any prescriptions. That is allowed, then we use. Okay, so we do not responsible, of course, on what they do outside, but we try to monitor. Okay, because anytime when they were caught as doping, their career will end. So we have to try to monitor. So we try to encourage them to use these good nutritions and hydrations, and also assist athletes understanding on the importance of knowing and taking responsible for the goals, what go into their bodies. Okay, so we will try to encourage athletes to obtain a clearance of supplements and medications, and if possible, get a certificate, okay, from your sports medical doctors, and before, so that you actually knows that the substance is safe. So, cases in professional athletes' career. So, unfortunately, our world number one, Dato Lee Chong Wei, just failed a doping test, even though he's the national icon. Okay, and because of that, there's a lot of things happen in his career. Okay, so he has to consult a sports psychologist, and though the substance he takes actually prescribed by the sports medical doctors, no substance in the banned list. Okay, so even though you do not know, you are still considered if they found that substance body. Likewise, the famous tennis player Maria Sharapova, okay, in the Australian Open, so meladonium is prescribed to help protect her heart issues from regulating metabolisms, but the drugs also helps in increase the endurance performance, and she was caught in doping as well. Okay, our famous, you can see the famous athletes, many famous athletes like Ben Johnson, Lance Armstrong, even those they won gold medals, Olympics medals, and Lance Armstrong admitted that he's doping, and he uses this doping, and finally he was stripped. Okay. So popular crickets, Pakistan crickets, Shoaib Akhtar, and even the cyclist Alberto Contador, all were caught as duty of doping as well. So in short, of course, we might see that the way is very easy, okay, but I will always say that evil even advise athletes to go. So before I end, I just wanted to show you to suit our themes of the conference, whereby the yoga, nutrition, scientific training methods for and rehabilitations for avoiding reactions to doping in sports. So there's many actually what we call an ergogenic effect. Have you heard about the word ergogenic? It also enhances your sports performance. Okay, so for example, in our study, if you just Google my name, sports, okay, by just having music in training, you will find yourself enhancing 8 to 12% of your rating of perceived exertion. So you will not get so tired and you have more motivations to train, okay, by using just music. But if you synchronize your music with your actions, it can enhance until 12 to 14%, which is very high, especially for your tired, if you are running a marathon, if you're exercising at a high peak level, by just using music, we're able to enhance 12 to 14%. Okay. Next, nutritions. By having good nutrition, athletes knows that they were able to recover a lot more faster. So, for example, after a competitions, after highly exertions, and athletes were able to recover by eating straight away, able to recover a lot more faster, 8 to 12 hours faster, by straight away taking proper nutritions, rather than waiting 2 to 3 editions. They might just sitting there, wasting time, procrastinating, and then do not eat. And you will find that they will be very tired the next day, the next few days, because it will take 6 to 7 days for recovery. Okay, rather than just 24 hours. You can use, of course, yoga, meditations, breathing techniques, relaxations, and even mindfulness trainings in order to help the athletes get into their zone and able to perform a lot more better in their performance as well. Okay, so with that, any questions before we conclude?
I thank
Okay.
Dr. Gary Ko and Malaysia, who
Actually, I like to.
who has enlightened us on drugs and doping and crime towards sports.
It's okay, it's okay then.
I would like to have this session open for discussion. If anybody is interested in asking questions, they are. Thank you.
Good morning to you all.
Hi.
Good morning, sir. Professor
Hi.
Dr. Gary Kong has excellently highlighted about the doping in sports. Thank you for enlightening us, sir. My question is about the blood doping. The same athlete has been used his own blood
Yeah.
for increasing the red blood cells
Yeah.
to increase his performances after storing the red blood cells of his own.
Yeah.
During this process, after increasing the red blood cells in the body, the athlete takes same blood, and how to detect it through scientific tests, because he was taking his own red blood cells to enhance his performance in sports. Please.
Oh, okay. Very good question. How can actually then the scientifics able to cope with blood doping? Okay, so you will find yourself right using the same bloods and then injecting back to the athletes. Okay, what actually increase? The red blood cell EPO actually increases. Okay, so the scientific person, when we check, you will find yourself urinates a lot. Okay, and then the increases of erythropoietins in the bloods as well, and then it will be caught very easily by having blood doping. And the other things, some of the athletes could not actually accept it, their body having adverse effects to their body. So we always say to our athletes, never try any new things. We don't know feedback. Okay, so people might say that it is a very simple technique, easy, but you can also just having that similar effects by having the acclimatized training, by live high, train high, and then you will able to actually have more bloods in your body as well. So you do not need to actually go for such procedure.
Thank you very much, sir. I would request the participants to be in brief because we have less time and we have to go much of the session. Yes,
Okay.
please.
Maybe we are talking about the leaves and stems to be cleaned up. But my question is on the root tree. It's about WADA. It's an individual body. Some developed countries are handling that WADA.
Yeah.
Still no. And I want to ask Lance Armstrong, after 7 years, he has been stripped for doping. So what was WADA doing for the past 7 years? Couldn't be able to identify the doping test is conducted. And most of the athletes are found. So what is the procedures they follow here? And what is the use of having a certificate?
Organization.
Yeah,
Okay.
I want to be more.
Yeah. Okay, I think it's a very fair question that why professional athletes actually were caught only after their prime times. Okay, let me say that doping, even our scientifics, is a very new area, and in fact, a lot more new tests not having. So we will test more. For example, if you come to our USM, University Science Malaysia Drugs and Research Centers, so now we were able to even check the genes that previously how long ago you were able took a dope before any substance in your genes and in your blood. Okay, but before that, never have that technologies. And let me say, current situation, if you go to like big events like Olympics, Commonwealth Games, definitely we have the technologies and in order to find all the dopers. Okay, and that's why you will see that recently the previous two Olympics, Russia were banned from the Olympics. Yeah.
Thank you very much,
So
sir.
that's
We-
new techniques now.
Yeah, thank you, sir. Let me just down because we're running out of time. We have two more lead speakers
Oh,
to
yeah.
say something. Let me just down something which you have spoken. This is you are known to be the leading in Asia. We are fortunate enough to have you with us, and we thank you for your fantastic deliberation. You have introduced regarding doping, understanding and prohibited drugs in sports, then few bits on rules and responsibilities, then criminal approaches of doping, in which you have stated about the motives of utilization of banned drugs, use of medications, social drugs and illicit drugs, then can be tested for drugs, then prohibited list of drugs in 2022, then 10 anti-doping rules violations, alcohol and sports, then predictions, dangers and case studies, sports practitioners' responsibilities and awareness regarding the doping, and then localites have the responsibility even to what you call evaluate or you have to make aware to the sportsman. Then you have enlisted many cases like leading elite athletes and sportsmen. Means legal drugs are those which enhances the performance without putting some extraordinary things via illegal what you call means and methods. Like music, nutrition, yoga, meditation, self-talk, technique, and relaxation. Thank you very much for this splendid session, sir. You are enlightened. Thank you. Do you mind I just give a few books to the Christian person?
A very good gesture by the resource person. Definitely bonding the relation between India and Malaysia. Now I call upon Dr. Abhijit Jagtap sir. He is an MBBS orthopedics. He will be delivering his lecture, and I would request Honorable Dr. Pradeep Deshmukh sir to please chair the session. Light करून PPT खालून ओपन कर खालून काय की तुमचं सरांचे ओपनच आहे ऑलरेडी तिथं ओपन करून दे मग मी हे करतो काय झालं बोला किती वेळा प्रेझेंटेशनचा प्रॉब्लेम ठीक आहे नेक्स्ट स्लाइड एक मिनट
Good morning, Vanessa.
फर्स्ट घे फर्स्ट
In the second session, for the keynote speaker, Dr. Abhijit Jagtap. Dr. Abhijit Jagtap is medical officer of this Punyashlok IIT. At the time of Maharashtra Sports, Maharashtra Inter-University Tournament, he organized one project regarding the physiological of all the participants, and he had taken effort to give the information to the all participants. Near about 3,000 participants have enjoyed its project regarding to having all the details of their physiological parameters. Now he is going to deliberate his thoughts regarding the sports injuries and rehabilitation of the injuries. So all the participants give a big hand to Dr. Abhijit Jagtap, and I request Dr. Abhijit Jagtap to present his thoughts regarding the sports injury and rehabilitation. Thank you.
Thank you, Dr. Pradeep sir, for the brief introduction. Good afternoon all. I am here to present second session of this conference, which is related to sports injuries. So what is actually meant by sports injuries? Sports injuries are those injuries which an athlete sustain on the ground and off the ground. So please remember, sports are not limited to ground field injuries, but they are beyond that. So how they are beyond that, that is I am going to cover in this session. I know sports injury topic is very vast and we cannot cover this session in a session of 20 minutes. Actually, a conference can be organized separately on this topic, but I try to cover this topic as much as possible in these 20 minutes. So, next. Coming to types of sports injuries, we have classified according to the type of body tissue that is involved in the injury and according to the duration of the injuries. So commonest classification is by according to the cause. So what is the cause? Why that injury happens? So the sports injury is classified as direct injury. So direct injury, that is meant by the injury sustained by a sports person or athlete on the ground while playing a particular sports. So all those injuries, they are classified under direct injuries. Secondly, indirect injuries are those injuries which are not happened on the field, but they are off the field, but they are results of the sports event or the particular category of sports. And thirdly, overuse injuries. So these overuse injuries, repeated use of particular body part, and that is causing the injury. These injuries are classified as overuse injuries. Second classification of sports injuries based on tissue or body part that is involved. They are classified as soft tissue injuries. These involve muscles, tendons, ligaments, cartilage, all those things. Even organs. So our abdominal organs that can be also get injured because of sports injury, especially pancreas, liver. These are the organs that can be injured while playing sports like kabaddi. Then heart tissue injuries. These involve injury to the bones. So all the fractures, then joint dislocation, succession. These comes to these heart tissue injuries. And thirdly, duration of the injury. So duration, whether the injury has sustained on the field, it is acute injury, and if it happens later on, it is called as chronic injury. So next slide. Then coming to the how to identify whether injury has happened or not. So these are the signs of injury. Remember, this is a sharp. It is swelling bound to happen, because blood vessels under that particular part or tissue gets damaged and they starts bleeding and swelling will happen. Then second, heat. So as a result of accumulation of blood, there is local rise in temperature of the body and you will feel the heat. Then third is altered joint, or you will get pain on movement of that particular part. Thirdly, redness. Fourthly, redness. So that injured part will become red. And lastly, it is painful. P stands for painful. So remember this sharp acronym. These are the signs of sports injury. So whenever you get any sports injury, you will have one of the signs and symptoms of this sharp. Next. So coming to the direct injuries, there are various types of direct injuries. The commonest we all face is abrasions. So abrasions. Then second one is contusion, third one is laceration, and fourth one is fracture. These are all 4 types of direct injuries. We will come one by one. Next. So abrasion, this is the commonest injury. We sustain it not only on sports field but even at our home. In abrasion, there is a superficial or top layer skin gets removed. And these type of injuries are very common and they are very easy to heal. They heal within 1 or 2 days. So not much to worry about this abrasion. Every sports person, or rather every person gets such kind of injury. At least in his childhood he will sustain such kind of injuries. Next. Second is, so contusion is a result of blood gets because body part, and you will get such type of injuries. These are called as contusion. This contusion results in accumulation of blood beneath the skin. That is, we in scientific term we call it as hemation, and that is they get resolved. They need some time to resolve, and they can result in some disaster complications also, like abscess, or cellulitis. So, of injuries, they need to have medical attention. Next. This is laceration. So laceration means cut in the body. So this could be a simple cut or multiple cuts or even more than that. And these kind of injury, they need to be stitched. We have to take stitches. These injuries cannot be managed only by dressing or cannot be managed by primary medical person, but they need medical attention. These injuries needs to be stitched in time. So they will get healed in 10 days. So this is called as laceration. Next. So this is fracture. Fracture means break in the bone. So your bone gets broken on the field as a result of injury, direct injury. These fractures again, they are of two types. First is closed fracture and second is open. So on the left hand side you can see the closed fracture. The bone has fractured, but the skin overlying that particular forearm is intact. So such type of fractures are called as closed fractures. Whereas the right hand side you can see the bone has fractured, the muscle has lacerated, bone has come out of skin. Such kind of injuries are called as compound fractures, and they are very difficult to manage. What type of fracture they need to be managed by orthopedic surgeon. They cannot be managed by anybody else. But for when a person gets injured and has such kind of fractures, our duty is to transport that patient in a particular way that will be helpful and less painful to that athlete who has injured, and we have to shift him meticulously to the hospital. For that we can use multiple splints. I am going to show that splints at the end of this session. Next. Coming to indirect injuries, these are sprain, strain, dislocation, tear and frictional sores. So these are all indirect injuries that can happen to an athlete. Sprain is the commonest indirect injury. We get it to and fro. Ankle sprain is the most common. Then knee sprain is there. Elbow sprain is there. Shoulder sprain is there. These are called as, in Marathi we call it as burgadne. Then strain. Strain means there is a break in some, especially you have heard of this Jasprit Bumrah and all those players strain. So they are they have muscle strain, muscle tear, and they need rest for few months to 6 months. So these injuries are quite grievous one. Dislocation means tear is meniscus tear. It is very common knee joint, we all joint, and it gets tear due to high loading velocity injuries. So especially in basketball, kabaddi, we get such kind of injuries. Even in football, we can get this type of tear and injuries. And then frictional sores. Next. So this is the typical picture of sprain. You will see the swelling over the ankle, and these injuries are quite common and they can be managed primarily. This is the strain. The commonest sites for strain are quadriceps, adductor, hamstring, trapezius, calf muscles. Next. So these are various sites where we can get sports injuries, strain. Next. Hamstring strain, it is also very common. Next. Achilles means that calcaneal heel bone is there, and the tendon joining that heel bone to the calf muscle that gets very easily strained. So these are commonest. Then you can see on the right hand side sore shin. This is very commonest problem, especially police bharti is going on, and these athletes who are training in running, they get such kind of injuries that is called as sore splints or sore shin. It is due to overuse. So it is also an indirect injury. Next. Close karte. So coming to next. So this is a picture of shoulder. On the left hand side you can see the normal shoulder. On the right hand side you can see the arm bone that is called as that has been dislocated, and such kind of injury has to be managed by orthopedic surgeon. Next. So this is a picture of meniscal tear or cartilage tear, even anterior cruciate ligament and posterior cruciate ligament. You all know knee joint has these two strongest ligament, anterior cruciate ligament and posterior cruciate ligament. So these get torn, and there are ways that again has to be managed by an expert, not by layman. Next. So these are frictional sore or bleb. Everybody will get such kind of injuries. So even if you change your footwear, you will change your shoes, you will get such kind of injuries. Or you will run barefoot or walk barefoot, you can get such kind of injuries that can be managed easily at home. Next. These are classification of sporting injuries, acute injuries, and overuse injuries. So I am not going into details of this. Overuse injuries are very common. Overuse means repeated use of that particular joint or that particular extremity. That is why we get injured. So commonest is patellofemoral joint. So our knee joint is very common. We use it often. It is a load-bearing joint, and due to this, commonest problem or commonest patient we are getting is osteoarthritis knee. Especially those are athletes, then those are wrestlers. They get such kind of injuries in their later of their life. Patellofemoral injuries are very common. Then heel injury is very common. Tibial injury is very common. Shoulder overuse injury is very common. Frozen shoulder is again one of the complications of sports injuries. Of overuse of shoulder, like in the sports like discus throw or this shot put throw, these players get such kind of injuries very often. Even cricketers, they get injury of shoulder, overuse injury of shoulder very often. Next. Plantar fasciitis, even heel pain, it is very also common. So in the morning, start getting pain in the heel, stiffness in the heel, and once you start walking, the pain will subside. This is very common phenomenon. So this is due to plantar fasciitis. It is also very outwards due to this overuse injury that is called a tennis elbow. It is again very common in the players who are playing tennis or cricket. Then golfer's elbow is also there. So golfer's elbow means on the medial side, medial condyle, it gets strained, and that is why you get golfer's elbow. So these kind of injuries are very common, and these kind of injuries are called as overuse injuries. Next. While dealing the sports injuries, you have to remember this principle, because many times we make mistake at this point of time. So the thing you have to remember is no harm. So what is this no harm? So H stands for no heat. So don't apply any sort of heat at the injured part. This is the commonest mistake we do. We try to apply some hot fomentation immediately when the player get injured. But instead of giving relief, it creates complications like cellulitis and abscess formation. So never ever apply any hot fomentation at the first incidence of sports injuries. No alcohol. People tend to get alcohol to reduce the pain, but it also harms yourself. Then no running. So if you are injured, you need to have rest. So don't rush for anything unless and until you are 100% fit and fine. And lastly, M. So no massage. Never ever do massage, because at the rural place there are tendency that people in complications. So later managing such kind of patients become difficult for the orthopedics. So massage is prohibited. So what to do? How to manage such kind of injuries? Next. So the price. So these are all acronym based management. Price. P stands for protect, R for rest, I for ice, C for compress, and E for elevate. So how to do this? So P means protect. Protect, you have to protect the injured part. Whatever part has been injured, you have to protect. You have to protect with the help of different kind of splints that are commercially available in the market. Rest is very important. Rest to the affected part and rest to the entire body to rejuvenate and to get out of that sports injury is very important. Ice. So instead of applying heat, you can apply ice. Ready-made ice packs are available in the market. Whenever there is an injury and there is a swelling due to injury, you need to apply this ice. So what does this cold fermentation or ice application does? It minimizes the internal bleeding and it minimizes the swelling. So it enhances or it helps to minimize the swelling. and helps to recover fast from that injury. Compress. You have to apply compression on the affected part using crepe bandages. So you all know crepe bandages. So you can use these crepe bandages to compress that particular part. And elevate. Elevate means you have to keep that affected or injured extremity above the level of heart. So elevation, what it does, it reduces the swelling. So suppose if your leg is injured, you need to lie down, you need to rest, and you have to keep pillows below your legs. Next. So this is how you can apply the rest, ice, compress and elevate. You can do SPRICE. Remember this SPRICE acronym, so that this is the first and foremost principle of managing any sport, any kind of sports injuries at the level of college, at the level of tournament. And once you manage the patient in such a way, you can transport that patient immediately to the health. You can protect using these splints. I have brought some splints. But while taking this splint, you again remember you need to have good splints from the reputed brands, because there are many fraud companies. They are coming with a cheaper alternative. For example, so this is a crepe bandage. So this is a good quality crepe bandage. So it costs around 150 to 200 rupees. But the cheaper alternative you will get at 20 to 30 rupees. But that is useless, because the first and foremost use of this crepe bandage is applying enough pressure if you get quality products. So remember this thing, you have to use quality products. So brands like Visco, Flamingo, these are some quality products. They are dealing in these things. Next. This is ice pack also available. So this is again ice pack. You can get such kind of ice pack. You can keep it in freeze and you can use whenever time you want. So even right now, gels also come. They can also be used for ice compression. And this is again cheap. You can get it at 30-40 rupees. If you don't have ice pack, what to do? You can keep a simple mineral water bottle in your freezer section. So that can be also act as a ice pack. Or there are ice trays in your freezer. You can also use that as a ice pack. Then there are various braces, knee braces and all those things. Next. Final rule, that is you have to start applying the crepe bandage from distal portion to the proximal portion. Because many times what happens, we apply crepe bandage in a wrong way and the ultimate result is we get swelling in the extremity. So remember, so suppose your hand, you have to apply crepe bandage to the hand. You have to start from the fingers to your arm. Don't apply crepe bandage from elbow to the fingers. So this is the cardinal rule. Next. Elevation. In this way you can give elevation to your injured leg or limb. If your hand is injured, you can use the arm pouch sling. That can be a bandage. You can create an arm sling and elevate that particular hand. But these are health problems related to sports. That is, I have mentioned these problems. So first is athlete foot. So many times we use shoes and socks for longer duration of period, and our finger beds get wet. There are chances to get fungal infection at these web beds. So these are called athlete foot. So the simple solution is to keep these web space dry and use some antifungal topical solution, or you can get help from medical person. Next. So these are again various fungal infection because of sweating. Sports person gets a lot of perspiration, he gets sweat, he gets wet, especially at groins, axilla, at the back of ears. So these are the places where we can get kind of functions. Subungual hematoma. So prolonged use of shoes can, or ill-fitted shoes can cause such kind of things. Your nail bed can get damaged and ultimately this black nail has to be removed. So this is again one of the commonest thing. So remember, you have to use proper shoe size for your sports. So never ever try to use too fit or too loose shoes, or otherwise you will end up in having such complications. Varicose veins, this is again one of the commonest problems, especially those not sports person, but they need to stand on the ground for longer duration of periods, such as cricket umpires. So for an entire day, they has to stand on the cricket field, and they tend to have such kind of problem that is called as varicose veins. These varicose veins, there is a simple solution to this, that only use stockinets. So stockinets are just like our socks that have to be pulled up high. So it will relieve this kind of problem. And even if the problem persists, then you have to take medical help. Next. Muscle cramps, these are again very common. They are due to dehydration. On the field, you get lot of sweat and you lose sodium, potassium, and you will get having dehydration. So simple solution is to get rehydration at every break. So you will see at the cricket match, there are sweat a lot and there are chances that they get muscle cramps. So even this season, now summer has been started in India. So in summer season, muscle cramps are very common. Even for normal person, those who are living in Solapur, the local temperature is almost 40 to 44 degrees, and there are tendency to get such kind of cramp. So try to eat normal natural drinks. First is water, lemon water, or nariyal water. Supplements that you can use. There is no need of any fancy cold drinks or soft drinks to solve these problems. So simple lemon, nariyal water or your water that can solve this problem. Next. So taking care of injured athlete is very important. Not only physical care but mental care is also important. Next. So this is a typical first aid kit that you all should have at your college or whenever you are going to the tournament. So these are the crepe bandage, Dynaplast, sumo spray, then these ice packs. So ₹100 you can create your first aid box, and you can utilize your gymkhana fees for the person and the matches. So remember, you have these things, and you need to have some sort of training in first aid management. So how to clean the wounds. Next. So these are the steps. So how to clean the wounds. So there is simple solution that is called as hydrogen peroxide. If there is abrasion, you can spray this hydrogen peroxide on the injury, on the abrasion, clean that and leave it. For abrasion, there is no need to dress. You can keep it open, it will heal on its own within 2 days. But if it is lacerated or contusion, you need to take medical care. For contusion, for immediate management, apply the ice pack. That is the only thing you can do, and then you can use crepe bandage and compress that particular thing so that internal bleeding will stop and hematoma won't form, and you can transport that patient to the medical care. Next. For fracture, you need to remember only, so fracture can get at any place. If it is a closed fracture or if it is a open fracture, only thing you have to do is to splint things. Splint means support. You have to support the fractured part, whether it is an arm or thigh or leg. You have to splint with proper splint. If splints are available, it's good. If splints are not available, you can use cardboards and you can splint these things. And remember to align that part in a normal anatomical position. Normal anatomical position means the most comfortable position that a particular human body has. So if it is or it is fractured, it is dislocated, you need to keep it in normal anatomical position and shift him immediately to the concerned hospital. Next. So these are various splints. You can see I have brought some splints over here. If anybody is interested, you can meet me and see these splints. These splints cost from 200 rupees to 2000 rupees. There are various splints right from for thigh, for leg, for shoulder, for humerus, even for your neck. So these are, even for your back, there are different belts. There are and you get all such kind of splints in your college. It is always better because once and all you will be having all these things, and this can be repeatedly used for any number of persons. So it's in such kind of splints. We have purchased at the time of Krida Mahotsav. We have all these facilities made available at every corner of ground. Next. So preventing sports injuries. So this is the key feature: warm up, cool down, stretching, and equipment management. So you all know about this thing. I am not going into detail of this because warm up is very much important. Even cooling up is also very important. Stretching. So you all being from physical education background, you need not to learn these things again. You need all these things. Only thing is that equipment management means You have to use proper equipments which are meant for that particular sports. So if you are playing cricket, you need to use protect the arm guard, the skull cap, the helmet. So you remember the injuries sustained to the cricketers and they died on the field. So Raman Lamba, he died on the field. Even the Australian batsman, he died due to injury. So you need to wear proper equipments which are made for that particular sports. For if you are playing basketball, you need to wear kneecap because injuries are very common in basketball. You need to wear even in for kabaddi. You need to wear kneecap, anklets. These are very important. So these prevents the sprain, strain, and all sorts of injuries. So using appropriate equipment or guards is very much key principle of preventing these sports injuries. Next. Taking mental care of the injured athlete is very important because the one who has injured, he goes through a lot of these things. He's get frustrated. He feels isolated. So if it is a team game and one person get injured, we have to make him sit out from the team, and he feels isolated. So taking his mental care, he could land up in a depression, anger, or he could get lost. So you have to take proper mental care. You have to assure him that there is no problem, you are still part of the team, you will get to play later on. So these kind of things you need to take care as a sports coach. So mental care is also very important of these things. Next. So these are some tips for mental care. You have to reassure that person, make him comfortable. You have to show sympathy. You have to make him involved in the team decisions. You do counseling of that particular person, and peer support. So you can make his or her colleague talk with him and make him comfortable. Next. You can also take professional help from doctors, from physiotherapists, counselor. Even there are sports psychologists who can also help you to counsel your sports person. So these are sports is a teamwork. It is not a single man's game, and managing sports injuries also a teamwork. You need short period. I have tried to cover each and every aspect. Even if something is missed on my part, you can have any questions. This session is open for questions.
Thank you, Dr. Jagpal. Ladies and gentlemen, as you know, Dr. Jagpal has neatly presented his thoughts on of injuries, identification of injuries, direct injuries and indirect. Likewise, he also presented the first aid in sports injuries, how to manage the sports injuries, also how to prevent the injuries, and also he suggested us to regarding the mental care and other things as warm up and exercise. So this topic is regarding the how to manage or how to prevent the sports injuries and types of sports injuries. So if any question from the audience, you may ask.
So related to the head injury.
Head injury.
Yeah, small tips about the open wound and the closed wound, how to handle in the head
If it happens to head, see, if lacerated wound is there and it is, you have to, the decision is based upon the size of that injury. If there is laceration, remember our skull is rich, it has very rich blood supply. So then you need to take care, you need to have stitches, you need to send him to the doctor. Or otherwise, if it is a minor one, no need to worry. You just clean that wound with hydrogen peroxide first and apply some betadine or any antiseptic ointment you are having. There is no need to have some fancy ointment. What is available with you, you can use that. That is the, and remember there is one, again there is one myth that injured part has not to be, water has not to be used for that injured part. But clean water is the first treatment for any kind of injury. If our hand gets injured, just put on the tap and keep that hand. So all the dirt should be washed away with the water. That is the principle.
Sir, thank you for your presentation enlightening us in sports injuries. Especially in sports like basketball, cricket, badminton, the ligament tear at knee joint occurs normally, sir. What is the process of treatment and how the rehabilitation takes place?
Okay, this is very good question and common. This is ligament injury is very common. As I said, there are two sorts of ligament in the knee joint. One is anterior cruciate ligament and one is posterior cruciate ligament. So injuries to the ACL, that is anterior cruciate ligament, are as grade 1 to grade 4. So grade 1, simply it's like get a stretching of the ligament. So ligament is not torn, but it is simply stretched, just like our thread or any other thing. And grade 4 is completely tear of that, complete or partial tear of that particular ligament. So depending upon these grades, we need to manage such patients. And these grades or this tear cannot be diagnosed simply on the X-ray, because many times meniscus or these ligament injuries, they get missed. Why? Because people tend to do X-rays and X-ray shows nothing, but still there is some problem lying with that particular person. Remember, swelling, as I said earlier, sharp swelling, swelling persists. If there is ligament injury or this meniscus injury, knee joint tends to swell. And these kind of injuries are only diagnosed by doing MRI. So you need to have imaging MRI, and MRI will show what sort of tear is that, whether it is grade 1 tear or whether it is grade 4, and depending upon that, injuries are managed. So if it is grade 1 tear, we do nothing. We just give him knee brace. There is a knee brace, and we give him and advise him rest for at least 1 month to 1.5 months. And after that, we start gradual exercising, gradual stretching of, send such patients to the physiotherapist and to proper regaining of muscle strength and all those things, and that person can again rejoin the sports at any point of time. But if it is a partial or complete, such kind of injury has to be managed surgically. There is no any options. So there is a surgical repair. We can do it with arthroscope. So by doing arthroscopy, we can repair this. We can simply stitch this. And such kind of persons, they also need rest for at least 2 months, at least. And after that, they cannot participate immediately in any sports event, but they has to be taken care of gradually. They need to have knee exercises. Then only they can participate in the sports event.
Thank you.
Yeah.
My question is, what is the different types of supplement and steroids in our body?
Okay, so this is directly not related to sports injuries, but being doctor things. So remember, which is not natural, it is many of the times it is harmful. So steroids, these are the such kind of drugs which are actually boon to the human being, but at the same time, if they are not used judiciously, they can become a bane. So steroids, they directly affect all the systems. Your kidneys can get damaged. You can get diabetes. Prolonged use of steroids can land up into having diabetes. You can land up into osteoporosis. Osteoporosis means your bones become brittle. So prolonged use of these steroids. So never ever take steroids. If you have to take steroids, you have to take it only at the advice of doctor. Then coming to the nutritional part, I think Dr. Manali Kane, she is going to cover that protein supplements are coming up, energy drinks are coming up. But as far as my knowledge and my expertise is concerned, these are all harmful to the body. Because I have seen at least 5 cases of renal failure at the age of 27, and I investigated those cases, and they were having such kind of supplement because of various reasons. So, artificial energy drinks. So as I said, nariyal water is the best tonic. You can have nariyal water or lemon water. So this thing you can have it at your own. Even now in this summer season, you can use this or raw mango. You can use juice from that raw mango also. But never ever use such kind of things. This is my advice. But I think you can get elaborative information on these things in tomorrow's session.
once again express my gratitude to the organizer to giving the opportunity to chair this session. Thank you. Over to the organizer. After all these informative sessions, I please have the rest of our hospitality. We have our lunch arrangements left. So please, and after that, right, 2:45 will be having the session, and Dr. Rajesh